Hello, everyone. My name is Ruth, and this is my presentation on reproductive health care and confidentiality for minors age 13 and up. So my thesis is that patient confidentiality should be respected in cases of reproductive health care for patients of all ages 13 and above. My main reasons for this are safety and personal choices regarding sexual orientation and gender orientation. Safety, a lot of teenagers and adolescents find themselves in difficult situations with their home life. Their parents may be neglectful or abusive, and they don't feel comfortable sharing everything about their reproductive health care with their parents. Personal choices regarding sexual or gender orientation, a lot of adolescents and teenagers are exploring their sexuality and their gender identity during this time, and many of them may not feel comfortable sharing decisions about their gender identity or sexual orientation with parents or guardians for fear of abuse or neglect. So a bit of data about this topic that I found from a study about confidentiality concerns in reproductive health care is that 7.4% of people aged 15 through 25 would not seek sexual or reproductive health care because of concerns that their parents might find out about it. Additionally, teenagers aged 15 through 17 who spent some time alone in the past year during a visit with the doctor or healthcare provider were more likely to receive sexual or reproductive health care services in the past year than those who had not. So while 7.4% may not seem like a very large margin, it is still a significant group of people who are not getting sexual or reproductive health care that they need simply because of concerns about confidentiality. Additionally, the fact that teenagers who spend more time alone with doctors are more likely to receive sexual or reproductive health care, it proves that if we were to have better confidentiality laws around this topic, that more teenagers would get and seek reproductive health care services than if they had to share their information with their parents. So a counterclaim for the topic is that 13 is not mature enough to make decisions about reproductive health care. But I believe that many children and adolescents, teenagers, they start sexual activity and they start questioning their identity as well as menstruation around this time. So if a person becomes pregnant or has an STD or needs help learning about their menstrual cycle, it's really important for them to feel safe to go to their provider and to ask these questions and to get healthcare for those issues. And without the confidentiality, a lot of them would go without the healthcare and would suffer very, very devastating consequences. So another counterclaim is parental support. Many people believe that teenagers need support from their parents or guardians during this time because it's a difficult situation. But I would argue that a lot of teenagers can choose to inform their parents if they feel they need support. And it's more of a question of safety, of whether or not it's safe for the individual to tell their parents about the situation, and giving the teenager the choice to inform their parents if they feel the need is much safer and is much smarter for the individual. So my conclusion is that better outcomes come from open communication between the provider and the patient, and that open communication happens when patients feel safe. So in order to make those patients feel safe, we need to have confidentiality laws that allow teenagers above the age of 13 to make decisions about whether or not they want to share their sexual or reproductive health care information with their parents or guardians. So this is the source that I used for my information on the data slide. Thank you for listening to my presentation.